See, naltrexone. Naltrexone is a opioid antagonist. Example of opioid antagonist: naloxone, naltrexone, and nalmefene. Naloxone, naltrexone, and nalmefene are opioid antagonists. They are pure opioid antagonists. These drugs have no agonistic effect. Okay, they are pure antagonist with no agonistic activity. Naloxone, naltrexone, and nalmefene competitively reverses the effect of both natural and synthetic opioids. They competitively reverses the effect of both natural and synthetic opioids, but do not completely reverse buprenorphine induced respiratory depression. opioids को opioids के इफेक्ट को कॉम्पिटिटिवली रिवर्स करता है, but does not completely reverse the effect of buprenorphine. ठीक है, it does not completely reverse the buprenorphine induced respiratory depression. Naloxone also blocks the analgesic effect of placebo and acupuncture. It also blocks the analgesic effect of placebo and acupuncture and the effects of endogenous opioid peptides. Okay? It blocks the analgesic effect of placebo, acupuncture, and endogenous opioid peptides. It is orally not effective because of high first pass metabolism, short acting. On IV administration, it immediately antagonizes all the action, especially the respiratory depression of morphine and other opioids. Okay, orally not effective. It has a very high first pass metabolism. Okay, short acting. If given IV, it immediately antagonizes all the action, especially respiratory depression of morphine and other opioids. IV naloxone precipitates withdrawal symptoms in morphine and heroin addicts. IV naloxone precipitates withdrawal symptoms in morphine and heroin addicts. So naloxone, naltrexone, nalmefene, these are opioid antagonists, pure opioid antagonists with no agonistic activity. They competitively reverse the effect of both natural and synthetic opioids, but do not completely reverse the buprenorphine induced respiratory depression. Naloxone also blocks the analgesic effect of placebo, acupuncture, and the endogenous opioid peptide. Very high first pass metabolism, so not effective orally. Short acting, IV administration पे it immediately antagonizes all the action, especially the respiratory depression of morphine. IV naloxone precipitates withdrawal symptoms in morphine and heroin addicts. ठीक है, तो it precipitates withdrawal symptoms in morphine and heroin addicts. Uses of naloxone. The main therapeutic use of naloxone is for the treatment of morphine and other opioid poisoning. Okay, treatment of morphine poisoning and other opioid poisoning. In the treatment of opioid overdose, naloxone rapidly reverses the respiratory depression induced by opioids, except buprenorphine, where it causes partial reversal of the respiratory depression. ठीक है, तो मॉर्फिन पॉइजनिंग में, ओपियोइड पॉइजनिंग में, ओपियोइड ओवरडोज में ये मेनली ये सबसे जल्दी रेस्पिरेटरी डिप्रेशन को रिवर्स करता है. ठीक है, एक्सेप्ट ब्यूप्रीनॉर्फिन वेयर इट कॉजेज पार्शियल रिवर्सल. टू ट्रीट नियोनेटल एक्सफाइजिया ड्यू टू द यूज ऑफ ओपियोइड्स इन मदर ड्यूरिंग लेबर. Morphine poisoning, opioid overdose, and to treat neonatal asphyxia due to the use of opioids in the mother during labor. Use of naltrexone. Naltrexone जो है, it is orally more potent and has longer duration of action than naloxone. Naltrexone is used for opioid blockade therapy to prevent relapse in opioid dependent individual. Naltrexone, it prevents the relapse in opioid dependent individual. It is used for the treatment of alcoholism. It reduces the urge to drink. Naltrexone को हम ओपियोइड डिपेंडेंट इंडिविजुअल्स में रिलैप्स को प्रिवेंट करने के लिए यूज़ करते हैं. नालट्रेक्सोन इज़ यूज्ड फॉर ओपियोइड ब्लॉकेड थेरेपी. To prevent relapse in the opioid dependent individual, it is used for the treatment of alcoholism as it reduces the urge to drink. Methyl naltrexone is a derivative of naltrexone, has only peripheral action. It can be used for the treatment of constipation due to opioids. Methyl naltrexone is used for the treatment of constipation due to opioids. Nalmefene. It is administered intravenously. Nalmefene intravenous administration longer than naloxone. Useful in the treatment of opioid overdose. Given intravenously longer than naloxone and useful in the treatment of opioid overdose. Endogenous opioid peptides, endorphin, enkephalins, and dynorphins. These are naturally occurring substances present in the brain and other body tissues. Endorphins, enkephalins, and dynorphins. They are called endogenous opioid peptides because their action is similar to opium alkaloids, that is morphine. These peptides appear to evolve involved in placebo and acupuncture induced analgesia. ठीक है. Example of endogenous opioid peptides, endorphin, enkephalins, and dynorphins. These endogenous opioid peptides are these endogenous opioid peptides appear to be involved in the placebo and acupuncture induced analgesia.